Welcome to the Living Well during COVID-19 training part 2. We hope you enjoy the training and it helps support you to live a healthier, more active life. Living Well during COVID-19 training part 2 covers smoking, alcohol and drugs. Let's start section 2 by looking at smoking. In 2020, 14.4% of adults in the UK smoke. In Bradford, this figure is higher than the national average of 18.5%, and the figure rises to 29.4% for routine and manual workers. Also, 14.4% of women are smoking at the time of their baby being born. Smoking is the biggest cause of preventable death in England, accounting for nearly 80,000 deaths each year. 1 in 2 smokers will die from a smoking-related disease. It is the largest cause of preventable death across the Bradford district. It is responsible for around 800 deaths a year, and every year a further 1,179 children take up smoking. Smoking affects your body and can damage nearly every organ in your body, including the lungs, heart, blood vessels, reproductive organs, mouth, skin, eyes and bones. Smoking can affect your body if you breathe in smoke from people around you. This is called passive smoking. Bradford Council is supporting a new campaign called Today is the Day, which encourages thousands of smokers considering quitting to take the opportunity to stop smoking. The new campaign, launched by Action on Smoking and Health, features a heartfelt plea for smokers to quit today to protect themselves from smoking-related diseases and increased risk of severe illness from COVID-19. On a positive note, so far, 1 million people have quit smoking during the COVID-19 pandemic.
Smoking causes around 70% of all lung cancers, as well as causing cancer in many other parts of the body, including the mouth, throat, voice box, esophagus, bladder, bowel, cervix, kidney, liver, stomach and pancreas. Smoking can damage your heart and increase your risk of having a stroke or heart disease. Smoking can also cause severe, irreversible respiratory problems. Smoking is known to increase the risk of becoming severely ill from COVID-19. As well as smoking cigarettes, tobacco that you do not smoke, including pan, gutka and chewing tobacco, is not a safe way to use tobacco. It can all cause cancer and can be as addictive as smoking. Chewing smokeless tobacco such as pan or gutka is popular with many people from the South Asian communities, but all forms of tobacco can harm your health. Research has shown that using smokeless tobacco raises the risk of mouth cancer and esophageal cancer. Cigarettes, BD and shisha. A World Health Organization study suggested that during one session on a water pipe or shisha for between 20 to 80 minutes, a person can inhale the same amount of smoke as a cigarette smoker consuming 100 or more cigarettes. Like cigarette smoke, water pipe smoke contains cancer-causing chemicals and toxic gases such as carbon monoxide. Second-hand smoke is dangerous, especially for children. The best way to protect loved ones is to quit smoking. At the very least, make sure you have a smoke-free home and car. When you smoke a cigarette, a roll-up, pipe or cigar, most of the smoke doesn't go into your lungs. It goes into the air around you, where anybody nearby can breathe it in. Second-hand smoke is the smoke that you breathe out, plus the side stream smoke caused by the lit end of your cigarette. When friends and family breathe in your second-hand smoke, what we call passive smoking, it isn't just unpleasant for them, it can damage their health too. Pregnant women who are exposed to smoke during pregnancy have a higher risk of a premature birth, and their baby is at risk of low birth weight. Once baby is born and baby is exposed to breathing in smoke, the risks of cot death are increased. The only way to protect your friends and family from second-hand smoke is to keep the environment around them smoke-free. The best way to do this is to quit smoking completely. If you're not ready to quit, make every effort to keep your cigarette smoke away from other people and never smoke indoors or in the car. You should always smoke outside and close windows and doors to prevent smoke from re-entering the house. Ask your visitors to smoke outside. Don't smoke in the car or allow anyone else to. There are over 5,000 chemicals found in a cigarette, many of them toxic. You might be surprised at some of the chemicals found in cigarettes, such as arsenic, which is a poison, or formaldehyde, which is used in mortuaries. As you can see, there are many other chemicals used in cigarettes, many of which can be highly dangerous and can cause cancer. Although the effects of smoking can be serious, when you stop smoking, there are many positives. Just 20 minutes after your last cigarette, your pulse rate will already be starting to return to normal. After 8 hours, your oxygen levels will be returning to normal and carbon monoxide levels will have reduced by half. After 48 hours, all the carbon monoxide in your body has gone and mucus begins to clear from your lungs. Your sense of taste and smell improves. After 72 hours, breathing feels easier because your bronchial tubes have started to relax. Your energy levels will also increase. After 2 to 12 weeks, blood will be pumping to your heart and muscles better because your circulation is improving. After 3 to 9 months, coughs, wheezing and breathing problems will get better as lung function increases by up to 10%. After 1 year, awesome, your risk of having a heart attack is now half that of a smoker. After 10 years, great news, your risk of dying from lung cancer is now half that of a smoker. And after 15 years, brilliant, your risk of having a heart attack is now the same as someone who has never smoked. Now that we know the benefits to stopping smoking, let's have a look at the most successful way to quit. Surveys show that 2/3 of current smokers would like to quit, but only 30 to 40% make a quit attempt in any given year. On the plus side, medication combined with specialist support means you are 4 times more likely to be successful in quitting smoking. The main types of medication offered to help quit smoking are either prescription stop smoking tablets, Champix or Zyban, or nicotine replacement therapy, or NRT. Your local stop smoking service will be able to help you decide which is the right medication for you. All are available from the NHS with a prescription, and NRT can be bought from pharmacies and other shops such as supermarkets without a prescription. Nicotine replacement therapy, NRT. The main reason that people smoke is because they are addicted to nicotine. Nicotine replacement therapy, or NRT, is a medication that provides you with a low level of nicotine without the tar, carbon monoxide and other poisonous chemicals present in tobacco smoke. It can help reduce unpleasant withdrawal effects such as bad mood and craving, which may occur when you stop smoking. NRT is available in different formats. A stop smoking advisor, pharmacist or your GP will be able to help you choose which best suits you. It's available as skin patches, chewing gum, inhalators, which look like plastic cigarettes, tablets, oral strips and lozenges, nasal and mouth sprays. Patches release nicotine slowly, some are worn all the time and some should be taken off at night. Inhalators, gum and sprays act more quickly and may be better for helping with cravings. There is no evidence that any single type of NRT is more effective than another, but there is good evidence to show that using a combination of NRT is more effective than a single product. For example, combining a patch with a faster acting form such as gum, inhalator or nasal spray. Treatment with NRT usually lasts 8 to 12 weeks before you gradually reduce the dose and eventually stop. So who can use NRT? Most people are able to use NRT, including adults and children over 12 years of age, although children under 18 should not use the lozenges without getting medical advice first. Pregnant women, your doctor may suggest NRT if they think it would help you quit. Breastfeeding women, your doctor can advise you how to do this safely. Champix and Zyban work by reducing your craving for a cigarette. These are available on prescription only and are not available to pregnant women or people with certain health conditions or those under age 18 years.
In recent years, e-cigarettes have become a very popular stop smoking aid in the UK. Also known as vapes or e-cigs, they are far less harmful than cigarettes and can help you quit smoking for good. What are e-cigarettes and how do they work? An e-cigarette is a device that allows you to inhale nicotine in a vapour rather than smoke. E-cigarettes do not burn tobacco and do not produce tar or carbon monoxide, two of the most damaging elements in tobacco smoke. They work by heating a liquid that typically contains nicotine, propylene glycol, and/or vegetable glycerine and flavourings. Using an e-cigarette is known as vaping. So will an e-cigarette help me stop smoking? Many thousands of people in the UK have already stopped smoking with the help of an e-cigarette. There's growing evidence that they can be effective. Using an e-cigarette can help you manage your nicotine cravings. To get the best out of it, make sure you're using it as much as you need to and with the right strength of nicotine in your e-liquid. A major UK clinical trial published in 2019 found that when combined with expert face-to-face support, people who used e-cigarettes to quit smoking were twice as likely to succeed as people who used other nicotine replacement products such as patches or gum. You will not get the full benefit from vaping unless you stop smoking cigarettes completely. You can get advice from a specialist vape shop or your local stop smoking service. Getting expert help from your local stop smoking service gives you the best chance of quitting smoking for good. How safe are e-cigarettes? In the UK, e-cigarettes are tightly regulated for safety and quality. They're not completely risk-free, but they carry a small fraction of the risk of cigarettes. E-cigarettes do not produce tar or carbon monoxide, two of the most harmful elements in tobacco smoke. The liquid and vapour contain some potentially harmful chemicals, also found in cigarette smoke, but at much lower levels. So what about risks from nicotine? While nicotine is the addictive substance in cigarettes, it's relatively harmless. Almost all of the harm from smoking comes from the thousands of other chemicals in tobacco smoke, many of which are toxic. Nicotine replacement therapy has been widely used for many years to help people stop smoking and is a safe treatment. Are e-cigarettes safe to use in pregnancy? Little research has been conducted into the safety of e-cigarettes in pregnancy, but they're likely to be much less harmful to a pregnant woman and her baby than cigarettes. If you're pregnant, licensed NRT products such as patches and gum are the recommended option to help you stop smoking. But if you find using an e-cigarette helpful for quitting and staying smoke-free, it's much safer for you and your baby than continuing to smoke.
Make sure you find the right support before you quit, for example a GP, practice nurse, pharmacist, stop smoking service. All stop smoking treatments work better when used alongside a programme of stop smoking support. Find your reason to quit. Choose a reason that's strong enough to outweigh the urge to light up. Think of your £1 million reason to quit smoking. Set a quit date and prepare for it. Deal with nicotine withdrawal by using medications such as NRT, Champix or Zyban. Get support from family and friends. Keep busy and change routines. Identify when you crave cigarettes and list strategies you can use. Keep your hands and mouth busy. Download the free Smoke-Free app for mobile support. If you would like to learn more about stopping smoking, here are some websites you might like to visit. Bradford District Stop Smoking Service covers all Bradford and Airedale area and is a free service. Appointments are available in a variety of settings from early mornings to evenings. Just ring the service, you don't have to be referred. Appointments mostly every 2 weeks for 12 weeks. Advisors are friendly and helpful and concentrate on helping people quit. The service itself is free. The treatments are charged at prescription price, so if you're entitled to free prescriptions, there is no charge. If you pay for your prescriptions, the cost is often cheaper than over-the-counter cost. There is also the option of purchasing a prepayment certificate, which is cheaper than the overall cost of buying the treatment for 12 weeks. Time for a quiz. Question 1. After how long is your risk of having a heart attack half that of a smoker? A. 1 year. B. 3 years. C. 5 years. Question 2. Children exposed to second-hand smoke are more likely to have which of the following illnesses? A. Ear infections. B. Severe and frequent asthma attacks. C. Bronchitis and pneumonia. Or D. All of the above. Let's have a look at the answers. Question 1, the answer is A, 1 year, and question 2, the answer is D, all of the above. There are many different reasons people drink alcohol, and during the COVID-19 pandemic, it may seem like a way of relaxing, coping with added stress, taking your mind off the constant news of COVID-19, combating boredom, or even to help you sleep. Alcohol is often treated differently to other drugs. It's legal, socially acceptable, and may even be encouraged. However, regularly drinking more than the recommended amount can negatively affect your health and make you more at risk from the effects of COVID-19. Alcohol is a depressant and can interfere with processes in the brain that are important for good mental health, as well as contribute to symptoms of severe depression. Drinking alcohol can also affect your weight and disrupt sleep. As we've seen, there are many different reasons why people may drink alcohol. This slide shows that 10.4 million people are drinking alcohol at levels of increasing risk and higher risk. Over the next few slides, we will look at the effects that alcohol can have on your body. Take a moment to think about if you drink, how regular this is, and if there are any triggers for your drinking. In England, 40% of adults are drinking over 14 units per week. The Chief Medical Officer's guideline for both men and women state that to keep health risks from alcohol to a low level, it is safest not to drink more than 14 units a week on a regular basis. If you are regularly drinking as much as 14 units per week, it is best to spread your drinking evenly over 3 or more days. If you have 1 or 2 heavy drinking episodes a week, you increase your risk of long-term illness and injury. The risk of developing a range of health problems, including cancers of the mouth, throat and breast, increase the more you drink on a regular basis. If you wish to cut down the amount you drink, a good way to help achieve this is to have several drink-free days a week. Binge drinking usually refers to drinking lots of alcohol in a short space of time or drinking to get drunk. In the UK, binge drinking is drinking more than 8 units of alcohol in a single session for men, 6 units of alcohol in a single session for women. By looking at the diagram, we can see that it doesn't take many drinks to reach this limit. Single occasion drinking. The Chief Medical Officer's advice for men and women who want to keep their short-term health risks from single occasion drinking to a low level is to reduce them by limiting the amount of alcohol you drink on any single occasion, drinking more slowly, drinking with food and alternating with water, planning ahead to avoid problems. An example of planning ahead is to make sure you can get home safely or that you have people you trust with you. The sorts of things that are more likely to happen if you misjudge your overall alcohol intake on a single occasion can include accidents resulting in injury, causing death in some cases, misjudging risky situations, losing self-control, for example, engaging in unprotected sex. Certain groups of people are more likely to be affected by alcohol and should be more careful of their drinking on any one occasion. These can include those at risk of falls, on medication that may interact with alcohol, or those with any pre-existing physical and mental health problems which could be exacerbated. If you regularly drink on a weekly basis and wish to minimise both the short and long-term risks to your health, this single occasion drinking advice is also relevant for you. Alcohol misuse contributes either wholly or partially to over 200 health conditions, leading to hospital admission due either to single occasion drinking or to the toxic effect of alcohol misuse over time. Conditions include cancers, including liver, mouth, head and neck, breast and bowel, cardiovascular conditions, stroke, pancreatitis, liver disease, depression and anxiety, dementia, sexual problems such as impotence or premature ejaculation, infertility. Heavy drinking can also increase your blood pressure and blood cholesterol levels, both of which are major risk factors for heart attacks and strokes. Long-term alcohol misuse can weaken your immune system, making you more vulnerable to serious infections. It can also weaken your bones, placing you at greater risk of fracturing or breaking them. Regular drinking also increases the amount of calories consumed and can contribute to weight gain and obesity. As well as having significant impact on your health, alcohol misuse can have long-term social implications. For example, it can lead to accidents and injury. More than 1 in 10 visits to accident and emergency departments are because of alcohol-related illnesses. Violence and antisocial behaviour. Each year in England, more than 1.2 million violent incidents are linked to alcohol misuse. Unsafe sex. This can lead to unplanned pregnancies and sexually transmitted infections. Loss of personal possessions. Many people lose personal possessions such as their wallet or mobile phone when they're drunk. Unplanned time off work or college. This could put your job or education at risk. Homelessness, family breakup and divorce, and financial problems. Take a moment to look at this slide and work out your score in relation to your drinking habits. If you score 11 or above, you should consider speaking to your GP. You may want to take a photo of the slide to take with you.
Spend a few moments looking at the top tips for cutting down on alcohol. Get medical advice before you stop drinking if you have physical withdrawal symptoms, such as shaking, sweating, or feeling anxious until you have your first drink of the day. It can be dangerous to stop drinking too quickly without proper help. Let's see what you have learned from the alcohol section. Question number 1. What is the maximum number of units men and women should consume in a week? Is it A, 21 units or B, 14 units? Question number 2. In the UK, how many units in one session is classed as binge drinking? A, 8 units for men and 6 units for women, or B, 12 units for men and 10 units for women? The answers are question number 1, B, 14 units. Question number 2, A, 8 units for men and 6 units for women. If you would like to learn more about cutting down or stopping drinking alcohol, the websites on the slide can help you.
The next section we are looking at is drugs. Different people use different substances. Initially, drugs are taken as a solution to a problem such as pain relief, stress, boredom, to fit in or to escape or relax. But sometimes eventually the drugs can become a problem, and these can have wide-reaching effects on health and well-being. Most forms of substance abuse may give you a temporary feeling of well-being or being in control, but all of them can ultimately damage your health. If you need treatment for drug addiction, with the right help and support, it is possible for you to get drug-free and stay that way. A GP is a good place to start. They can discuss your problems with you and get you in the right treatment. They may offer you treatment at the practice or refer you to your local drug service. If you're not comfortable talking to a GP, you can approach your local drug treatment service yourself. Visit the Frank website to find local drug treatment services. The details of this will be on the further information page. Here are some top tips to support recovery from addiction. Take a moment to have a look through these. Whichever tips you find useful, remember it is always important to get the right professional support. It's time for a quiz. Question 1. Marijuana is a widely used recreational drug, also known as pot, weed or cannabis. A. True. B. False. Question 2. People of any age, income, education level and gender can abuse prescription drugs. A. True. B. False.
And the answers are question number 1, A, true, and question number 2, A, which is also true. If you would like more information on drug support, please see the links on the slide.